Thank you for your interest in NCCARE 360. This is a recording of the NCCARE 360 General Information Session, and it is recommended for organizations that are not currently network partners or users of the platform, but may be interested in becoming one. In this session, we'll provide a high-level overview of the NCCARE 360 program and discuss our partnerships and how we collaborate to run the program. We'll examine what it means to be a network partner and clarify roles and expectations, and we will provide next step instructions for those who would like to join the network. Unfortunately, we will not be able to provide a demonstration of the technology platform itself in this recording, but we will provide several options at the end of the presentation for those who would like to schedule one. Now let's begin. NCCARE 360 is one of the key strategies embedded in North Carolina Department of Health and Human Services Healthy Opportunities Initiatives, which was an initiative designed to help build a statewide multi-component shared infrastructure that provides all North Carolinians with the opportunity for health. Several other strategies that resulted from this initiative include standardized screening questions for social determinants of health and the Healthy Opportunities pilots. And because we know that social determinants of health domains like food insecurity, housing instability, access to transportation, and preventing intimate partner violence and personal toxic stress, can directly impact health, NCCARE 360 was created to help bridge healthcare and human services across diverse populations and geographies to improve the health of communities and reduce healthcare costs overall. NCCARE 360 then is a tool that was created to improve the actual process of connecting people to the community resources they need to be healthy. We are a coordinated network, meaning we are connecting providers in the healthcare system like doctors, clinics, hospitals, and insurers with community-based organizations like food pantries and diaper banks and churches and shelters, all in this web-based platform where they can communicate with each other in real time, assess for and identify unmet social needs, make electronic referrals, securely share client information, and track outcomes together. So this technology allows these providers both in the healthcare system and in the community to work together to coordinate care for their shared patients and then track those outcomes together by monitoring whether the person received the resource or service that they were just referred to. And all of this helps to ensure that everyone is on the same page, that the person seeking help is less likely to fall through the cracks, and it really helps to close that care loop. Embedded in the NCCARE 360 platform is an SDOH screener developed by NCDHHS that helps providers make the connection with how unmet social needs can affect someone's physical health. So folks don't always make that connection. So when they get to their medical appointments, they're not readily sharing those needs, and sometimes those conversations may not come up. So the screener is useful for healthcare providers or in other settings where discussions about social needs might not typically happen. And the screener can prompt providers to get a better sense of their patients' full needs and then connect them to the right resources that bridge the gaps to those medical conditions. And then it improves health outcomes and reduces long-standing health disparities. Using the screener in the NCCARE 360 platform is not required, but it is a tool within the tool that is available to help make those connections easier. The screener is also available to download on the DHHS website at the Office of Healthy Opportunities webpage. So here's an example of what this might look like in your community. Let's say we have Jane, who's a community health worker, and she visits a client in her neighborhood named John to enroll him in a vaccine program. She finds out that John lost his job recently and cannot afford food, so she takes action. She logs into the NCCARE 360 network, finds a nearby food pantry, and sends a referral to them on John's behalf. The food pantry receives the referral and determines that they can assist John with his food needs, so they accept the referral, and the food pantry coordinator contacts John to get him set up to receive food boxes. Now, the next time Jane follows up with John, she'll be able to see in the NCCARE 360 platform that the food pantry provided John with the food that he needed. And now she can help him focus on any other health issues that may have popped up. She can also simultaneously send a referral for job placement services since John had been out of work for a while, and then she can track the outcomes of the referral in the platform as well. NCCARE360 is a public-private partnership between NCDHHS and the Foundation for Health Leadership and Innovation, which allows community organizations to join and use NCCARE360 for free. And our implementation partners are the United Way of North Carolina, NC211, Expound Decision Systems, and Unite Us. So the chart you see here helps break down the various roles of each partner because we know it can get a little confusing understanding who does what when there are several organizations involved. So starting at the top, we have FHLI, and we serve as the administrators of the program, primarily responsible for the management and oversight of the platform. We also hold contracts with all of our implementation partners to ensure that deliverables are being met, and we just try to make sure that everything is running smoothly. NCDHHS is the collaborative partner for the long-term strategy and vision of the program, as well as assisting with funding opportunities to help keep the program going. The United Way of North Carolina provides a team of dedicated resource navigators who support complex referrals or organizations that may not be able to stay with the client through the entire referral process, and they support self-referrals from the assistance request form on our website. United Way also provides a robust public-facing statewide resource directory whose resources are replicated for the NCCARE360 platform as what we call out-of-network resources. Unite Us provides the shared web-based technology platform that powers NCCARE360 and is what is used to send, receive, and manage those electronic referrals and then track their outcomes. Unite Us also provides onboarding, training, and technical support to all of our network users. And finally, NCCARE360 joined with NCServes in July of 2021 to increase the number of resources available to active duty service members, veterans, and their families. So they are our military coordination center. Now we'll highlight the role of our United Way of North Carolina and NC211 partners in the NCCARE360 program. So the NCCARE360 Resource Navigators provide referral services to individuals seeking help on their own if they are not already connected to a provider or an organization. The navigators are based in the NC211 Coordination Center, but they are assigned specifically to NCCARE360 cases. They offer clients a person-centered approach to resource coordination and case management, and they support the NCCARE360 network by assisting with complex referrals, such as simultaneous housing and job placement service needs that may require that additional support. The resource navigators send referrals on behalf of clients to active network community-based organizations. They receive referrals from active users for clients with complex needs that may be outside of their scope to support. So, for example, if an individual presents to a food pantry with more than just a food need, they may also have a need for rental assistance to stay in their home, as well as transportation needs to get to work. And the food bank coordinator does not have housing or transportation resources, and they may not have the capacity to be able to send referrals for all of these needs. So they can send a referral on behalf of the client to a resource navigator who will be able to serve as a makeshift case manager and send appropriate referrals on the client's behalf and then follow up with the client to ensure that they've received the help that they need. Navigators also support self-referrals from the assistance request form on the NCCARE360 website. So to reiterate, the navigators do not provide resources directly to clients, but they do help coordinate potential resources through those platform referrals. So they're available when clients have multiple complex needs, again, sustainable housing, financial assistance, emergency housing, things like that. And they're available if your organization does not have the capacity to stay with the client throughout the referral process due to any capacity issues. If they are available, or we encourage all network users to first try and find and refer clients to appropriate resources themselves when possible. But of course, that may not always be the case. And so the navigators are always there to lean on when needed. So for those individuals who need help but are not already connected to a provider or an organization and they just aren't sure where to turn, they can submit an easy-to-use assistance request form on our website at nccare360.org/request assistance. And this form will be routed to the resource navigator who will quickly contact the client and begin that referral process with them. NC211 maintains a statewide resource directory that is available on their website at nc211.org. And for our partnership, this directory gets replicated to our NCCARE360 website as well as our platform as our out-of-network resources. So NC211 employs a team of 5 resource coordinators who support the network by completing verifications and updates of all 14,000 plus resources in their 211 database. And these updates are completed following Inform USA, formerly known as AIR standards, and the NC211 style guide, ensuring that resource information in the directory is provided at a 5th grade reading level to help increase accessibility. And during these verifications, the resource coordinators are really good at finding pockets of resource gaps, and they will work with stakeholders to find additional resources or maybe help determine the best ways to fill those gaps. Individuals can visit nccare360.org/resources to access the resource directory on the NCCARE360 website or at nc211.org on the NC211 website, where they can search for resources in their area. So this would be where individuals can search, for example, for a food-related need. They would just type in a few keywords describing that need, such as food pantry, emergency meals, or grocery assistance, along with their location, and the database will populate organizations near them that could potentially help. And then the individual would reach out to those organizations on their own to request assistance. There may be some confusion about the difference between the NC211 resource coordinators and the NCCARE360 resource navigators. So here we'll try to clarify that a little further. So the NC211 Coordination Center provides information and referral services, meaning the coordinators take calls from individuals who need help finding resources. Those coordinators will determine the individual's needs and help them find local resources through their 211 database. And then the coordinators will give that information to the individuals to contact on their own to request services. So they do not send a referral in the platform. The NCCARE360 resource navigators take it a step further. They will work with the individual to determine all of their various social needs and then use the NCCARE360 platform to send referrals to those organizations on the individual's behalf. They also provide that light case management and will follow up with individuals to ensure they got what they needed. And as just a quick note here, when an individual contacts NC211, the resource coordinators will notify them of the navigator's services and ask if they would like to be connected to a navigator in case that individual just needs some additional assistance that falls outside of those information and referral services. Unite Us provides the technology that powers the NCCARE360 platform, and here we'll highlight some of the security features of the platform, but again, we will not be able to provide a demonstration of the technology itself, but we will provide some options at the end for those who would like to schedule one. So we've taken great care to ensure that the NCCARE360 platform is secure. So all of the information is stored and transferred within the Unite Us secure and compliant platform. So security compliance includes HIPAA, which protects patients' health information. There's FERPA, or the Family Educational Rights and Privacy Act, which is the federal law that protects the privacy of student education records. FIPS is the Federal Information Processing Standards, which ensures that systems and products meet the U.S. government's security and interoperability requirements. And 42 CFR Part 2 protects patients' substance use records. So the Unite Us platform is secure in all of those standards. Clients are matched with the provider and services for which they most qualify. So we ask our users to regularly update their program's information, which includes those eligibility requirements, because we know that making sure a client is eligible for a program before sending a referral can help get them to the services that they need a little more quickly. Clients' information is captured once and shared on their behalf. So this helps to prevent potentially re-traumatizing a client or frustrating them when they have to repeatedly tell their story to different providers. So with NCCARE 360, they tell their story once, it gets captured in the platform, and then anyone who provides care and resources to them is able to see it. That means that service providers have an insight into the entire client journey. So with the example I provided earlier, our CHW Jane was able to see in the platform all of the services that John received, as well as the food pantry coordinator and anyone who was helping him with job placement services. So on that note, though, there is also a sensitive population feature available, which means that only those directly involved in the referral and providing of care to individuals with certain service types can see those referrals. So sensitive services include mental and behavioral health services, substance use services, domestic violence services, and some subsets of physical health like sexual and reproductive health services. So again, these sensitive services are only visible to those working directly with the client. And finally, longitudinal data is tracked, which allows for better informed decision making and by the community care teams. So now we want to take a moment to highlight what it means to be a network partner. So we acknowledge that this is a tool, and just like any tool, it works best when we have many organizations join and use it. So we want to be clear up front about what it is that we ask of our users. We do have some inclusion criteria that we consider when adding organizations to our network. So we strive to add partners who will be dependable and reliable and are providing quality services. So we bring in partners who provide a community service and offer that service at large and not just to its own members. Those are often nonprofits, government agencies, social or professional organizations. It's great if they can provide free or low-cost services, but that's not a requirement. We have a lot of community groups and more. We ask that the organization be licensed and accredited if that's applicable to their organization type. And of course, the organization cannot discriminate based on race, color, national origin, age, disability, religious beliefs, gender, or sexual orientation. We do have a downloadable list of these criteria on our website if you wanted to read the complete list, but this just gives you an idea of what we are and are not looking for. We also ask our network partner organizations to agree to our network standards to help increase that shared accountability. So our standards include responding to referrals within 2 business days. Now, this doesn't mean you have to provide the service or resource within 2 business days, but that you've taken some action on it. You've received the referral and you've either accepted it, you've rejected it, you've held it for review, or you've forwarded on to another organization. We ask that partners make 3 attempts over 10 business days to contact unresponsive clients before closing a referral or case, so that we're doing our due diligence in contacting clients. We ask that they regularly review and update organization and program information. And these are things like eligibility requirements, hours of operations, phone numbers, things that are super important for others to know when determining whether they should send a referral to you. We also ask that they regularly update user information when users leave or should no longer have access within 2 business days of the change. So if a staff person leaves and you need to reassign a new person to that role, please do that within 2 business days. And closing cases within 2 business days of the case outcome. So you've provided the service, the client is happy, go ahead and close that case as resolved within 2 business days so that we can close that loop and so that others working with the client can see that they've received whatever it is that they've needed. And then there's the ability to temporarily turn off whether you receive referrals when necessary. So if you're at capacity, say you have no more food boxes for the month, or maybe your organization only provides seasonal services and you're currently out of season, you can indicate that you aren't accepting referrals at this time by toggling off the ability to accept referrals. And then when you're ready to receive them again, you can turn that back on. There are a lot of great benefits to our network partners who are using NCCARE 360. Unlike traditional referral methods, NCCARE 360 allows you to track referral outcomes for your clients. You're able to monitor the entire client journey. You have access to data that may help with writing grant proposals, funding opportunities, or your organization's own strategic planning. And it also allows for improved workflows and more equitable provision of resources. When an organization decides to join the NCCARE 360 network, this is the general process that they will follow. First, they identify an organization administrator or an org admin who will manage the onboarding process and serve as the NCCARE 360 lead at the organization. This person will complete the inquiry form on our website, which will be routed to our onboarding team at Unite Us. Next, the org admin will receive an official onboarding form. And once they submit that, it begins the official onboarding process. So Unite Us will begin building out the organization's profile. Then, once the profile has been set up, the org admin will receive platform login credentials to activate the account. The org admin will log in, enter the organization's information, including the service or resource that the program is providing, their list of users, etc., which helps Unite Us complete the profile and get it ready to go live. In the meantime, while that profile is being completed, all users should attend software training to learn how to use the NCCARE 360 Unite Us platform. There are several options available for this, including self-paced trainings and live trainings, so users can learn in a style that suits best for them. And then finally, the organization will launch and use NCCARE 360 to send, receive, manage, and track referrals. This process timeline is very dependent on the organization. So it could take anywhere from a couple of weeks to a couple of months, depending on how much time can be dedicated in the beginning. Anyone who is interested in joining the network is encouraged to visit nccare360.org/join to submit the brief inquiry form that will go to our Unite Us onboarding team. If you have any questions, please reach out to us at connect@nccare360.org, which is a shared email inbox that we monitor daily. And then anyone who has attended an information session or is already working with us and is interested in having us join a panel or be a guest speaker at your next event can submit a speaker request at nccare360.org/request speaker. There are currently two options to see a platform demonstration. The first option is to email Unite Us directly using the email address ncnetwork@uniteus.com. A network success manager there at Unite Us will work with you to schedule a virtual demo for you and your team. Additionally, you may join a live information session. We hold these sessions on the third Friday of every month from 12 to 1 p.m. via Zoom. And you can scan the QR code to register for the date that best fits your schedule. But please note that these sessions will contain the same information that you received here in this recording, but it does include a live demonstration of the NCCARE 360 platform and a live Q&A session. And this concludes our recording of the NCCARE 360 General Information Session. Thank you so much for joining. We hope that you gained some helpful insights into the NCCARE 360 program, and we ask that you reach out to us if you have any questions at all. We hope to hear from you soon.